Let me tell you a real story. I'll call her Margaret. She was 68 years old, extremely sharp-minded, did crossword puzzles every morning, remembered every family birthday without needing to check a calendar, and her own daughter said she was the human Google of the house, the kind of person you ask about anything because you know she will have the answer. But something began to change silently and gradually, almost imperceptibly at first. Small memory lapses, simple everyday things that are often ignored. But over time, it became more frequent and more concerning. About 18 months after a new medication was added to her routine, her daughter called in desperation. Margaret could no longer remember what she had eaten for breakfast, began getting confused while driving home on a route she had taken for more than 20 years, and started repeating the same questions several times during the same conversation, as if the information simply was not being retained. The suspicion came quickly, possible early Alzheimer's disease, and the family was completely devastated, imagining a future of progressive memory loss and loss of independence. But here is the point that nobody told them and that you need to understand now. It was not Alzheimer's. It was the combination of medications she was taking daily. When a complete review was done with medical guidance, analyzing every medication, every dose, and every interaction, and strategic adjustments were made, something surprising happened. Margaret began returning to normal. Within a few weeks, there were already clear signs of improvement, and in about 4 months, she was once again doing crossword puzzles, remembering appointments, and speaking clearly, just like before. This is not a miracle. This is preventive medicine applied correctly. And that is exactly why this subject is so important and, at the same time, so neglected. Today you will understand which common medications can silently and over time affect your memory without you realizing it. Let's start with number 9, something extremely common and often ignored, diphenhydramine, known as an antihistamine widely used for allergies and also found in many sleep aid medications. Now think with me. How many times have you taken something like this without paying much attention, simply looking for quick relief from an allergy, itching, or a sleepless night? The problem is that this type of medication has what is called an anticholinergic effect, which means it directly interferes with acetylcholine, a neurotransmitter essential for memory, learning, and cognitive function. And when this system begins to be affected, especially with aging, the effects appear subtly, almost invisibly at first, but accumulate over time. Mild mental confusion, frequent forgetfulness, difficulty concentrating, slower thinking, and that feeling that the mind is not as clear as it once was. And the most concerning part is that many people use this type of medication frequently, sometimes daily, without imagining that it may be silently contributing to cognitive decline. This does not mean you can never use it, but it does mean you need to understand what you are taking, ask questions, seek guidance, and evaluate whether continuous use is truly necessary. Because many times the problem is not age, but rather the combination of substances the body is receiving every day. And this leads to an inevitable reflection. How many other common, seemingly harmless medications may be affecting your memory without you realizing it, while you believe it is simply the brain's natural aging process? How many of you have a bottle of Benadryl sitting on your nightstand right now? Probably many. And I completely understand why. It's inexpensive, does not require a prescription, and even says sleep aid on the package. It seems harmless. But what this little pink pill is doing inside a brain over 60 years old is something almost nobody explains. Diphenhydramine, the active ingredient in Benadryl, belongs to a class of medications called anticholinergics. And you are going to hear this term several times because it is fundamental to understanding the problem. These medications work by blocking a neurotransmitter called acetylcholine, which is essential for memory, focus, and alertness. When you are young, the brain can still compensate for this loss. But after the age of 60, acetylcholine levels are already naturally lower. When you further block this system, especially with frequent use, the impact begins to appear. And it is not subtle. Confusion, forgetfulness, difficulty concentrating, and a feeling of slower thinking. An important study published in the Journal of the American Geriatric Society showed that older adults who regularly use diphenhydramine have a higher risk of cognitive decline, including measurable changes in brain areas related to memory. And here is the most dangerous part. This type of substance is not only found in Benadryl. It appears in various products you would not even associate with allergy medications. Any medication labeled PM, nighttime, or sleep formula usually contains this type of compound. In other words, you may be consuming it without even realizing it. So what should you do? For allergies, there are safer options, such as second-generation antihistamines like loratadine, cetirizine, or Claritin, which do not cross into the brain in the same way. As for sleep, there are better alternatives, and we will explore those further later on. Now let's move on to medication number 8, the so-called proton pump inhibitors, known as PPIs. Raise your hand if you have ever been instructed to take a reflux medication every day for years without ever reevaluating it. This is one of the most prescribed groups of medications in the world. And the problem is not just the use itself, but continuous and indefinite use. These medications reduce stomach acid, which seems positive at first glance. But there is one crucial detail. Stomach acid is essential for absorbing vitamin B12, and B12 is absolutely critical for the brain. When there is a deficiency of this vitamin, symptoms such as memory loss, depression, neurological damage, and a pattern of cognitive decline that can easily be mistaken for Alzheimer's may appear. A study published in JAMA Neurology followed more than 73,000 adults over the age of 75 and found a concerning result. Long-term users of these medications had a 44% higher risk of developing dementia compared to those who did not use them. And it does not stop there. Research also indicates that these medications may accelerate the accumulation of beta-amyloid plaques in the brain, which are one of the main characteristics of Alzheimer's disease. In other words, something that seems simple, like treating reflux, may be silently affecting your brain health over the years. We are not talking about just a simple vitamin B12 deficiency. We are talking about a possible direct pathway at the molecular level toward neurodegeneration. And this is where you need to pay close attention. So what should you do? The first step is to talk with your doctor about the possibility of gradually reducing the use of these medications. In many cases, it is possible to transition using H2 blockers such as famotidine or Pepcid, serving as a bridge while the body adjusts. In addition, simple lifestyle changes can have a huge impact. Smaller meals, avoiding eating late at night, reducing foods that trigger reflux, and even slightly elevating the head of the bed can greatly help control symptoms naturally. And if you truly need to continue using this type of medication for a specific medical condition, then there is one essential precaution. Regularly monitor your vitamin B12 and magnesium levels, because silent deficiencies of these nutrients can directly affect the brain over time. Now let's move on to medication number 7, and this point really stands out. Medications for bladder control. Not because of the medication itself, but because of the lack of information many patients receive. Overactive bladder is a real and uncomfortable problem that affects sleep, daily routine, and quality of life. And when a doctor prescribes something like oxybutynin, it is natural to trust it. But what almost nobody explains is its impact on the brain. Oxybutynin is one of the most potent anticholinergics used clinically. This means it does not act only on the bladder. It easily crosses the blood-brain barrier and directly interferes with the same acetylcholine systems responsible for memory and learning. Studies show that with prolonged use, the hippocampus, a brain region essential for memory storage, may experience a reduction in volume. We are not talking only about mental confusion. We are talking about structural changes in the brain. A study published in the British Medical Journal showed that older adults who use strong anticholinergics for more than 1 year have about a 49% higher risk of developing dementia. And the most concerning part is that the first signs, forgetting appointments, losing objects, having difficulty finding words, are often attributed to natural aging. The medication is not even considered in the discussion. But there is good news. More modern medications, such as mirabegron, work through a completely different mechanism and present a much lower risk to cognitive function. If you use oxybutynin and have noticed any mental changes, this is a conversation you need to have with your doctor. Now we arrive at medication number 6, and here it is important to pause. Because we are talking about a class of medications that has helped millions of people over the years, benzodiazepines, commonly known as benzos. They are widely used to treat anxiety, panic attacks, and sleep disorders. And yes, they work. But the problem is not occasional use. The problem is prolonged, silent use that often extends for years without reevaluation. These medications act directly on the central nervous system, slowing brain activity. This may bring immediate relief, but over time it can affect memory, attention, and processing ability. And that is exactly why this class requires even more attention, closer monitoring, and greater awareness of what is being used daily. For many people, benzodiazepines were a true source of support during difficult times. That needs to be recognized. They help, and they help a lot in the short term. But what you need to understand now is what happens when this use continues for months or even years. These medications work by increasing the action of a neurotransmitter called GABA, which is the brain's natural signal to relax, slow down, and reduce anxiety. At first, this brings almost immediate relief. But over time, the brain begins to adapt. When GABA is constantly amplified, the brain itself reduces its natural activity in response. This directly impacts neuroplasticity, which is the brain's ability to learn, adapt, and form new connections. Memory begins to be affected, reasoning speed decreases, and emotional regulation becomes more unstable. A 2022 study following more than 8,000 older adults over 6 years showed that using benzodiazepines for more than 3 months increased the risk of developing Alzheimer's disease by about 51%, with the risk being even higher for long-acting medications such as diazepam, which accumulate in the body over time, including in brain tissue. And there is a trap here. When a person tries to stop, the rebound effect can be intense, stronger anxiety, worse insomnia than before, which creates a sense of dependence. That is why this type of medication should never be stopped abruptly. Withdrawal needs to be gradual and supervised by a doctor. There are alternatives that can be discussed, such as buspirone for anxiety, cognitive behavioral therapy for insomnia, and in some cases, the use of melatonin or magnesium. Now we arrive at medication number 5, and here it is important to keep a balanced perspective. Statins truly save lives. They are essential in preventing cardiovascular diseases, which remain the leading cause of death in people over 60 years old. In many cases, their use is absolutely necessary. But there is one point many people do not know. The human brain is composed of about 60% fat, and cholesterol plays an essential role in this system. It is responsible for forming the myelin sheath, the layer that surrounds neurons, and allows electrical signals to be transmitted quickly and efficiently. In other words, in the context of the brain, cholesterol is not an absolute villain. It is a fundamental structure for the proper functioning of the nervous system. And that is exactly why the use of these medications must always be individualized, monitored, and adjusted according to each person's needs, always seeking a balance between protecting the heart and preserving cognitive function. Cholesterol is not there by accident. It directly participates in the formation of synapses, which are the connections between neurons. Without adequate levels, these connections begin to fail, and communication within the brain becomes impaired. When cholesterol is reduced too aggressively with a statin, you may cross a threshold where the brain no longer has what it needs to maintain its structure and function. In fact, in 2012, the FDA itself updated statin labels to include possible side effects such as memory loss and mental confusion after reviewing thousands of patient reports. More recently, an analysis published in Frontiers in Aging Neuroscience showed that adults over 70 who used high-dose statins for more than 3 years showed measurable increases in mild cognitive impairment compared to non-users. But there is an important point that needs to be understood here. Not all statins have the same impact on the brain. The so-called lipophilic statins, such as simvastatin and atorvastatin, cross the blood-brain barrier more easily and therefore have greater potential to affect cognitive function. Hydrophilic statins, such as pravastatin and rosuvastatin, tend to have a lower impact in this regard, according to comparative studies. So what should you do? If you are using a statin and have started noticing signs such as brain fog, difficulty concentrating, or memory lapses, it is worth speaking with your doctor about the possibility of adjusting the type of medication. In addition, there is another rarely discussed detail. Statins may reduce levels of coenzyme Q10, a substance essential for energy production in cells, including brain cells. And this reduction may further contribute to symptoms of mental fatigue and poor cognitive performance. Now let's move on to medication number 4, and this one truly surprises many people. Amitriptyline. That is because it is not used only as an antidepressant. Over the years, it has also been prescribed for several other conditions, neuropathic pain, chronic migraines, fibromyalgia, and even sleep problems. It may seem unrelated to mental health, but its mechanism of action still carries an important effect that many people do not know about. Many doctors choose amitriptyline precisely because it causes drowsiness, using this effect as an advantage to help the patient sleep. But here is the critical point that almost nobody explains. Amitriptyline is one of the medications with the strongest anticholinergic effects still in use. This means it strongly blocks the receptors where acetylcholine acts, and you already understand how essential this neurotransmitter is for memory, focus, and learning. Studies show that this effect is so strong that it exceeds even some medications specifically developed for allergies or bladder problems. A landmark study published in JAMA Internal Medicine followed more than 3,400 people over the age of 65 for a decade and found a concerning result. Cumulative exposure to anticholinergic medications, with amitriptyline among the main contributors, was associated with a 54% increase in dementia risk. And the most surprising part is that this is not limited to high doses. Even low doses used continuously for years create a significant cumulative effect. The problem is that this impact does not appear abruptly. There is no clear warning sign. What happens is a slow erosion, difficulty finding words, confusion with simple sequences, loss of mental clarity, symptoms often attributed to normal aging for years without anyone questioning the medication. And there are safer alternatives that can be discussed with a doctor, such as duloxetine, Cymbalta, or gabapentin, which have lower anticholinergic impact. For sleep, very low doses of doxepin may be a more balanced option, and for mood, more modern antidepressants such as sertraline tend to be safer for the aging brain. Now we arrive at medication number 3, and here you need to pay very close attention. We are talking about antipsychotics. These medications were created to treat severe psychiatric conditions such as schizophrenia and psychotic disorders. They are powerful medications that profoundly alter brain function and come with a long list of side effects. The problem is that, in practice, they have been used much more broadly than they should be. In many cases, older adults who are simply confused, restless, or agitated end up receiving this type of medication not because they have a severe psychiatric condition, but because they are considered difficult to manage. This happens frequently in nursing homes, hospitals, and care facilities, often without the family even being fully informed. The Food and Drug Administration itself has issued a safety alert known as a black box warning, indicating an increased risk of death in older adults with dementia who use antipsychotics for behavioral control. This is not rare. It is a reality that happens every day. And that is exactly why this type of medication must be evaluated with extreme caution, always with a clear indication and strict monitoring. And even with all these warnings, prescriptions continue every single day. Now understand what is happening in the brain. Antipsychotics work mainly by reducing dopamine, a neurotransmitter essential for motivation, reward, movement, and executive functions. When dopamine is continuously suppressed in an aging brain, the impact goes far beyond what most people imagine. Emotions become more muted, thinking becomes slower, memory formation becomes more difficult, and over time an accelerated process of neurodegeneration may occur. A study published in The Lancet Healthy Longevity followed more than 25,000 older adults and showed that those who received antipsychotics for behavioral symptoms had a 71% higher risk of cognitive decline within just 12 months, even without a previous dementia diagnosis. If you have a family member in a care facility, or if you yourself were prescribed medications such as quetiapine or risperidone without a clear diagnosis of psychosis, it is essential to ask questions. Ask about the reason, the treatment plan, and especially the strategy for reducing or discontinuing the medication. You have the right to know and participate in these decisions. Now we arrive at medication number 2, and this one is rarely discussed but deserves far more attention. Paroxetine, commercially known as Paxil. It belongs to the SSRI class of antidepressants, the same family as medications such as Prozac, Zoloft, and Lexapro. And generally, when people talk about SSRIs, they think of more modern and safer medications. That is true for most of them, but paroxetine is an important exception. Unlike the others, it has a significant anticholinergic effect. In other words, It interferes with acetylcholine in a way similar to older medications, such as tricyclic antidepressants. A review published in Frontiers in Psychiatry showed that older adults using paroxetine experienced measurable reductions in short-term memory and word recall within the first year of treatment, something not observed with other SSRIs at the same dosage. For this reason, the American Geriatric Society included paroxetine in the Beers criteria, a list of medications considered potentially inappropriate for older adults. And the most concerning part is that it is still frequently prescribed to exactly this population. In many cases, the solution is simple. Speak with a doctor about the possibility of transitioning to options such as sertraline or escitalopram, which maintain antidepressant benefits with less cognitive impact, always through gradual adjustment. Now we arrive at the most important point of all. Number 1 is not a single medication. It is a pattern, anticholinergic polypharmacy. And this completely changes the game. Each medication on this list, by itself, may cause mild effects, often almost imperceptible, a little more forgetfulness, a little more mental slowness, something easy to attribute to aging. But in real life, people do not take only one medication. The average person over 65 takes 4 or more medications per day, and many take 6, 8, or even more, including prescriptions, over-the-counter drugs, and supplements. Often these are prescribed by different doctors without a complete view of everything being used. When several of these medications have anticholinergic effects, they do not simply add their effects together. They amplify them. An analysis published in Age and Aging followed more than 280,000 older adults and showed that those with a higher anticholinergic burden had a 120% greater risk of developing dementia over 10 years. This is not a coincidence. It is a silent pattern affecting millions of people. And the most important question now is simple. Do you know exactly what you are taking every day? The risk can literally double simply because of medication combinations. Medications that, in most cases, never came with a clear warning about memory impact. Now let me show you how this happens in practice. Imagine a 70-year-old woman. Let's call her Dorothy. Every night, she takes a sleep aid containing diphenhydramine, uses oxybutynin for bladder control, started taking amitriptyline for nerve pain in her feet, and also takes a reflux medication every day. 3 of these 4 medications have anticholinergic effects. Individually, each doctor considers them safe. But together, they create a burden on the brain that is directly associated with a high risk of dementia. And nobody added it all up. No doctor, no pharmacist. This is not an isolated example. It happens every single day. This phenomenon has a name, anticholinergic polypharmacy, and it may be one of the biggest silent factors behind dementia symptoms in older adults today. Now pay very close attention to this, because it is the most important point of all. Cognitive decline caused by medications can often be reversed. When the medication burden is correctly identified and reduced under medical supervision, many patients show real improvement. Memory starts coming back. Mental clarity reappears. Personality changes again. That brain fog feeling disappears. The brain is not passive. It is adaptable and capable of recovering when you remove what is harming it. So here is a simple plan you can start this week. First, write down everything you take. Everything. Prescription drugs, over-the-counter medications, supplements, sleep aids. Nothing should be left out. Second, research each item using the anticholinergic burden scale, known as ACB. It is a free tool that shows the risk level of each medication. Third, schedule an appointment with your doctor and say exactly this. You want a complete medication review focused on anticholinergic burden. A good professional will appreciate that. Fourth, ask about deprescribing, which is the process of reducing or discontinuing medications that are no longer necessary. This is already a recognized field in modern medicine. Fifth, if your doctor dismisses your concerns, seek a second opinion. You are not being difficult. You are being responsible about your health. There are even pharmacists specialized in geriatrics who can perform a complete medication review. Now let me ask you a direct question. How many of these medications are you or someone close to you using today? Have you noticed forgetfulness, confusion, or behavior changes and never connected them to medications? Because sometimes the problem is not aging. It is what you are taking every single day without realizing the impact. And that can completely change the direction of your health.